Hello, my name is Courtney Blankenship, and I am doing my presentation for Nursing 820 called Using Evidence-Based Practice in the Field of Nursing and Healthcare. The Clinical Practice Guideline and Electronic Medical Records. When working in a geriatric psychiatric facility, documentation was essential, as we are all aware, but like many facilities, the completion of documentation was far from satisfactory. I initiated a practice guideline on completing documentation for falls. At this facility, there were 5 areas of documentation and EMAR. There were also a multitude of other documentation that had to be completed on various shifts throughout a 72-hour period. As one can imagine, with there being such a large quantity of documentation needed, and with that need for documentation spreading throughout shifts and dates, fall documentation commonly got missed. Missing documentations and instructions on what type of assessments to complete after a patient fall caused inadequate health care for the patients and put the nurses at great risk for being reprimanded. I created a checklist for completing all necessary documentation post-fall for a patient, and this checklist could be handed off to the nurse coming into the new shift. In theory, this would allow nurses to complete the required documentation and even proper assessments in a timely manner per protocol standards. The fall checklist was first initiated in June of 2017 and remains in use today. There is no official date to determine the effectiveness of the fall checklist in ensuring timely completion of necessary documentation, which in turn ensures assessments are being properly completed per evidence-based practice guidelines. Being a manager at that point in time, I completed the audits on all of the fall documentation, and completion of all post-fall documentation and assessments significantly increased after implementation of the fall checklist. It also assisted newly hired nurses on navigating the complicated system used for post-fall documentation. Order sets based on evidence-based practice. Wells and Loshak, 2019, noted that implementing evidence-based order sets in healthcare reduced hospital length of stay, reduced mortality, and reduced medication errors. Although there are no statistics regarding the broad topic of implementing order sets, upon research of multiple articles of evidence-based practice on specific order sets, the statistics were immensely significant regarding increase in quality healthcare. One order set implemented at the geriatric psychiatric healthcare facility I worked at was stroke protocol. Since this facility was not for acute health and only based in psychiatric medicine, the facility lacked the ability to appropriately handle strokes and the patients had to be sent out. Also, physicians were only on site before 5 p.m. almost every day. Stroke protocol was created to ensure that appropriate available medication was given, instructions for healthcare staff were immediately implemented, and that the patient was sent to the closest emergency department. As we all know, the implementation of stroke protocols in acute care hospitals has significantly decreased patient injury related to the stroke. Wells and Loshak 2019 noted that stroke order sets in acute care hospitals significantly decreased mortality rates at 30, 60, and 90 days. Order sets based on evidence-based practice save precious time in patient care and lead to better outcomes for patients. Phone-based application using evidence-based practice. Using evidence-based practice to create phone application allows healthcare workers to quickly access data that can provide them information, recommended next steps based on symptoms or diagnosis, or use necessary formulas in a quick and easy way. There are multiple time-dependent diseases and injuries in which using a phone application can save precious time, in turn decreasing damages to patients and increasing good patient outcomes. Strokes in particular are the second leading cause of death and the most significant cause of disability in the world, with a mortality rate of 5.5 million. One particular phone application that can provide a lot of saved time in patient care, ensuring better patient outcomes. This application is called SPMIS. For this application, patient details are entered into the application by emergency responders. The application transmits the data to the hospital physicians. This allows healthcare workers to see the patient's data in real time and prepare the arrival of the patient. No longer do healthcare workers have to waste time on basic data or wait on a report from EMS before working on the patient. Now, healthcare workers can prepare everything necessary before the patient arrives by using EMS assessments of the patient, which will save precious time of doing that work after the patient arrives. There are an immense amount of phone applications that help healthcare workers provide more effective, time efficient, and quality care. And this page has my used resources.